This is Stigma, where we talk with leaders from many industries about how mental health and addiction have impacted their lives. Many people suffer silently from mental illness, addiction, depression, anxiety, and trauma. They never seek help because of stigma. In this podcast, host Stephen Hayes and his guests share their stories of recovery in order to encourage others to do the same. Here's Stephen.
Welcome back to another episode of the Stigma Podcast. Today's guest is Karan Singh. He's the founder and COO at Ginger, which is an on-demand mental health company based in San Francisco. Ginger has accomplished quite a bit in the last decade and has been named one of the top 10 most innovative companies within healthcare by Fast Company. They've also been identified by the World Economic Forum as a technology pioneer. Karan himself has worked across the healthcare ecosystem in numerous capacities, from consulting leading biopharma companies to commercializing health data analytics in other capacities, and a whole number of things. He did his undergraduate studies at UC Berkeley. He got his MBA from MIT. And while he was in a combined program with the Harvard Medical School and MIT Health in a science and technology program, he took a hiatus quite a while back to begin and to grow Ginger. I'll let him tell you more about his story, but there's a number of ways to get in touch with him. I'll link all of those in the show notes. And without further ado, Karan, man, thank you for coming on.
Stephen, thank you for having me. What a special time.
It's really, really a unique time, to say the least. I was just kind of wondering if you wouldn't mind sharing with our audience how you found your way into the world of healthcare and specifically mental health.
Absolutely. And thank you again for having me. Love the work that you've been doing to address the stigma. I think as an entrepreneur, as a founder, as an executive, as a father, I think any one of those labels, we don't do it nearly enough to be open about how real the struggle is. So I love being here and love being able to support however I can. I can jump right into my story, if you will, and if you wouldn't mind taking a deep breath in with me, help me settle.
Let's do it. For sure.
So my story started about a decade ago, actually, just over a decade. And I was on the other end of a phone call after a loved one tried to take their own life. And it really shook me to my core. I've always thought of myself as emotionally in touch, a good read on people. And, I had no idea. I was blindsided. So I started to dig deeper and, realize that culturally, socially, probably emotionally, mental health is just this incredibly tough topic to broach with family and with friends. And so, fortunately, my loved one is still here, but the system hasn't changed a whole lot for them. And so I couldn't shake this feeling that I really needed to do something about it. And I'd stumbled into healthcare coming out of undergrad and working in the biotech and pharmaceutical world, and ultimately went out east from the Bay Area to Cambridge and was in the dual degree program between MIT and Harvard, where we eventually launched Ginger almost a decade ago. Originally started as really a technology platform, if you will, with this core insight that there was or really is no blood test for your depression, that there's no easy way to measure stress. And we originally set out to use data from your smartphone to predict when someone might have a symptom flare. And based on that data, actually get them the kind of care and support they need. And eventually, and we can talk through the course of today, through some twists and some turns, evolved into becoming an actual provider of care ourselves.
Where did you get the idea, or when did you come up with the idea to use the smartphone? And sort of how did that idea evolve from idea to trying it to wherever it ended up?
Absolutely. The original thesis came out of research my co-founder was doing at the MIT Media Lab. And it was built on this notion that, really there isn't objective measures in mental health, that we largely rely on questionnaires like the PHQ-9 and the GAD-7 that I'm sure some of your listeners are familiar with, but they're largely subjective assessments, and that we could start to bring a level of rigor and objectivity to the space. And so we conducted dozens of research studies, probably over 25 IRB approved studies with the likes of Partners Healthcare to UCSF to Kaiser Permanente. And eventually we evolved into a population health platform to drive proactive care for chronic patients comorbid with mental health issues. And we started as a technology platform supporting health systems. We, looking back, we're able to nail the triple aim, do all the things you're supposed to do: cost, quality, experience. We raised some additional financing on that initial premise, and things were humming, I'd say, sort of overall. But when we took a step back and really kind of took stock of our commercial model and the impact we were having, we just realized that there was an incredible amount of friction at every step in the process, that we were sprinkled at the end of what we realized, I think, far after the fact was, a broken system. I mean, as I think all too well, you have to first break through the stigma, admit to yourself you might need help, and if you got up the courage to take some action, you'd walk in probably to your primary care physician, who'd ultimately hand you a list of names and have you dial for dollars to find someone available. When most have a voicemail box that was full. And if you did get through the door to see a therapist or psychiatrist, 60, 70% of the time that care could be subpar quality. And finally, when you walked out the door, you got charged list price at hundreds of dollars a session, since most providers are out of network. And so we just realized that our vision was a world where mental health was never an obstacle. And in order to stay true to that vision, we had to evolve. We had to go from selling into health systems to becoming one. And I remember that board meeting clearly. We raised financing from Coastal Ventures on one end and Kaiser Ventures on the other. And we were debating the virtues of automation of the doctor on one end to whether we wanted to be a health system or a hospital. That was a far bigger swing and a far kind of more evolved approach, if you will. And, I think ultimately we found a happy medium, probably between those two extremes. But in the moment, it was scary for sure.
So the business today, how would you describe it? How does that interaction that you described, that a consumer has or that a patient has, it sounds like a lot of friction and it's very expensive and they usually walk away without getting what they need. How does Ginger replace that negative user experience?
We've really evolved into becoming an on-demand mental health system. So probably the best way to think about it is like a virtual clinic for your mental health, with a team of coaches, therapists, psychiatrists, and really a technology backbone that allows us to deliver support in under 60 seconds, 24 hours a day, 7 days a week, and all across the country, all 50 states, and now in about 25 countries internationally. So a far cry, I'd say, from the weeks, if not months, most people wait to see a provider. The core sort of member experience, if you will, is we've partnered with many employers. So close to 500,000 members around the world have access to Ginger, from the likes of Sephora, the large cosmetics retailer, to Pinterest, the technology company, to SEIU 775, a really large labor union up in Washington State, to some of the nation's largest airlines and consulting firms. And so we'll work with an employer and provide a set of education and communication to those teams. A big part of it, and especially related to, I think, the topic of stigma, is we'll often interview or engage with leadership and executive within that company to have them be open, be honest about, quote unquote, the struggle and about the challenges they may be having. And that's usually facilitates or jumpstarts a conversation and enables a number of members to start to reach out, download our mobile app, and again, in under 60 seconds, get access to a coach, which is really the front door to our behavioral health system. They get to talking via text and really understand what might be going on. And for a subset of folks who might need an escalated level of care, we bring in a therapist or psychiatrist on to their care team and set them up with a video appointment, typically within a few days. And that team of coaches and therapists and psychiatrists really are delivering care on an ongoing basis, kind of really customized or personalized to your specific needs.
It sounds like to me that in today's world, with all that's going on that's probably a pretty highly in demand service you're offering. How do people find Ginger, and who can use it?
It's very, very much in demand right now. We're certainly seeing a pretty significant spike in utilization and both, kind of frequency and intensity of our members' mental health needs, probably due in large part to the COVID-19 crisis. We've seen this play out before. We saw close to a 2x increase in utilization of our services back after the 2016 election. We've seen this in 2018 when there were a few celebrity suicides, Anthony Bourdain and Kate Spade, where we saw a 2x increase in overall suicidal risk across our member population. So we've kind of seen these spikes play out, but the real kind of primary entry points to the Ginger system are one, through an employer, where we'll partner with an employer and provide access on demand to really anyone within their team and or of age dependents. And the second major bucket would be through our health plan relationships. So we're in network with Optum, with Aetna, Anthem, Kaiser Permanente, for instance, in certain regions. And through those relationships, are able to deliver in-network or covered care as it relates to our therapy and psychiatry services. So depending on the specific health plan, there might be a variety of different ways which you get tied to Ginger. One of which, for instance, might be you call the health plan's resource center, and they might direct you or refer you over to Ginger. You download the mobile app, you enter the code, and again, within typically a few days, 60 seconds, you're talking to a coach, and within a few days, you're talking a therapist or psychiatrist.
I would imagine the health plans love this because from my understanding is, they have these patients who have comorbidities who aren't dealing with their mental health. And when they do, a lot of times those comorbidities see improvements in the overall patient cost of the insurance company starts declining, including in physical healthcare costs. So is that kind of what your clients or your payers are seeing when their customers engage in mental health care on your platform?
Absolutely. I think, a big rationale for this is the comorbid, mental health needs for most of the chronic patients, usually a 2x increase in overall prevalence amongst that population. And so we certainly see that we're able to support those members. But I'd actually push this further, which is what we've been finding is, because our definition of quote unquote mental health is far wider than what most people have traditionally assumed is mental health, it means it's expanding beyond just the therapy or psychiatry visit, but to a broader subset of really quote unquote subclinical members who maybe with the traditional definitions wouldn't fall into the 1 in 5 who have a diagnosis of depression or anxiety, but are struggling, have symptoms of stress, may be depressed, may have levels of anxiety that we're able to support. And so whether that's, a patient or a member who's recently been diagnosed or going through a cancer treatment where they may not necessarily have a elevated PHQ-9 score, they're probably dealing with life, quote unquote, and, being able to talk to a coach and or get some level of additional support could go a long way in helping them support their own needs. So yes, very much so. I think it's both those that actually have a diagnosed comorbid condition, but also kind of the broader population that really is looking for on-demand support and when they need it.
And where do you want to see the platform go in the long run? I mean, what's the not really end state, not like an exit, but what's the level of care that you'd like to get to with the platform in the future?
That's a good question. I'd say ultimately, we're set up legally as in nationwide group medical practice. So for all intents and purposes, we're like a clinic or health system. Major differences, we don't have any real estate, and outside of our headquarters for the kind of G&A team. I think the fundamental crisis in this space is a massive supply and demand imbalance, and that the demand is continuing to go through the roof, even prior to COVID-19, but certainly during and post what we're going through right now. And the reality is that the supply isn't keeping up. And so if I think about where this ultimately goes, we have a set of interventions as a virtual clinic, which consists of, talking to a coach or therapist or psychiatrist or leveraging a set of content that we've built or that we've increasingly been acquiring. But there's a long tail of really powerful interventions that could be very helpful. And I think that the question for most people is often what works for whom, when, and how. And knowing what works for whom, when, and how is really in many ways a data question. It's really being able to understand what someone might have, get them access to the right level of care when they need it, track using a set of measurement to ensure they're seeing a symptom response, and ultimately getting them out of that support, or that level of support rather, as quickly as possible. So when I think about where ultimately we want this to go, it's about preventative mental health. It's about catching people early before they really have a crisis or a massive symptom flare. It's about kind of getting them through that door much faster than would have normally been possible, because technology allows us to do that, allows us to scale that in ways that ultimately are cost effective. And so ultimately being preventative, being virtual first or technology enabled, allows us to serve different kinds of populations. And so, as we continue to innovate on this, I think our goal is to continue to expand internationally into markets where our existing price points, at least today, wouldn't be supported. To continue to expand into government populations or government payer cohorts, where we can really start to unlock access at a cost-effective way.
It sounds to me like Ginger is really kind of pushing a new model of care delivery and being very successful with that. And I know that you talk and speak publicly about methods and models of care delivery, especially around behavioral health. And I was wondering if you could kind of give us a little bit of a primer on care delivery models in the behavioral space.
Absolutely. So let's see. I'll start with a story, and that is, since Stephen, you haven't asked me yet, but I'm sure it was coming. Why the name Ginger? And so, a big part of our focus and really kind of our care delivery model is a focus on prevention. It's about moving upstream. And the story goes, my mom used to feed me ginger and honey before I got sick, and she often knew I was coming down with something before I knew myself. And so this notion of being able to catch things early is really, I'd say, fundamental to our mission and how we've been thinking about care delivery. And that really starts with the idea of a mental health coach, a behavioral health coach that is a new level of care in the traditional care model that is incredibly powerful, that can really unlock and start to address some of the supply and demand imbalance, and start to allow people to walk through a door that doesn't feel as stigmatizing. For many people, and we've heard this time and time again, going to see quote unquote a therapist or psychiatrist is a really high bar. But seeing a coach feels a little bit more approachable. Feels a little easier, a little less friction. And our care delivery model is really built on this notion that every part of the stack, if you will, is practicing at the top of their skill set or at the top of their license. And so for a coach, it's really being able to enable them through technology to be able to focus on the right members at the right time, giving them prompts and tools to know who's doing well when and reach out appropriately. But equally importantly, it's giving the coaches tools to know when they might need to escalate up and really kind of bring in a therapist or psychiatrist, because a member actually does require a licensed level of care, or escalate out and really triage to, let's say, a crisis resource, for instance, if someone might be in a much more acute setting. And similarly, for the therapist, we want them to be really focused on delivering their therapy, but for a lot of the administrative overhead, a lot of the other tasks that might take up their day-to-day time, take that off their plate, make that as simple and as clean and as easy as possible. And similarly, and finally with the psychiatrist, really have them be focused on medication management, which is the one part of the experience that really no one else in that care delivery team can manage. And so, I think from a guiding principles, it's this notion of a collaborative, integrated team for whom everyone is really quote unquote practicing at the top of their skill set. I'd say another very maybe foundational element, which I'd say for folks who are coming at this from maybe a technology background, is sort of first principles, but has sometimes got lost given how complicated healthcare is to be member focused, patient focused. We call our patients members, and really ultimately to be able to reduce friction at every step in the process and make it as easy and as simple as downloading an app, entering a code, 60 seconds, you're talking to a provider. And there's a lot that needs to go on behind the scenes to enable that to happen. but it's removing that friction. And then I'd say maybe the last piece of this is you need to know what works. And so building a system that's measurement based, that's tracking every interaction and every outcome, so that not only can you prove to the member that they're getting better, to the clinicians that they're delivering great care, to the buyer, let's say an employer or a health plan, that they're seeing value from this investment, but frankly, just as importantly, that the system gets better and learns over time. Because there are going to be situations where our standard approach doesn't work. And for whatever reason, we might need to change course. And the only way we know that is if we're tracking that data and we're using that data to build kind of better systems, better tools, better workflows, better products.
When you talk about, building better workflows, tools, and products, it makes me think about a lot of the entrepreneurs out there that are listening to you right now. They're looking at Ginger and they see Ginger as one of those at the top of the food pyramid in the mental health space. You've raised a bunch of money. You've got great partners. You have good traction. You've got a great team. You have all these things going for you. And, I was kind of curious what you would say to an aspiring entrepreneur in the mental health space. Where are the holes or the tools or the platforms or what can an entrepreneur go after today in this space that you don't see being tackled yet?
Well, I'd say first and foremost, it's fast forward a decade later here, it's incredible that there is this groundswell of interest. And so I would encourage as many people as we can to be getting into this space. This is a massive opportunity, and we need a ton of great minds to be really thinking about this. And I think there's no question about that. I think second, it might be obvious based on what we're talking about here, but this supply and demand imbalance is, we think, really the sort of fundamental issue. That the mental health crisis is certainly not going away, and our standard approaches to be able to meet that need aren't accelerating fast enough. And so we've got to think about integrated approaches, about preventative approaches, about moving upstream to really be able to help people far earlier to really tackle this in a much more holistic way. So I think there's a ton of opportunity to be able to move upstream and to actually enable the existing infrastructure to tackle those or to support those that are most acute, most in need, that actually might need a required inpatient hospitalization or other sort of kind of inpatient resource that can only be done in an in-person setting. Another big one, and I think we were starting to talk about this a little bit earlier, is the struggle is real. The reality is being an entrepreneur. It's an entrepreneur in mental health. It's so easy to forget that. It's so easy to burn yourself out in the process. And I know I definitely did at times throughout this journey. And you've got to enjoy the grind. It's a long game. None of these initiatives or efforts are going to overnight change this, but in the long run, they're going to make a material, significant, if not the impact that's ultimately going to kind of change the trajectory here. And so, you're going to have to, and I know I did, enjoy that struggle, enjoy that grind, find, a variety of resources to help support you through this process. I think, especially in times like today and with everything that's going on right now, finding your tribe, taking care of yourself while you take care of your team is so critical, because ultimately you're going to need to be in this for the long haul to be able to deliver on the impact that I think you ultimately want to see.
What are some ways you've learned to take care of yourself and take care of your team when you're in the midst of the grind? You've got deadlines, capital is short, you've got all the constraints of being in a startup. What are some of the things that an entrepreneur can do, things that you've learned to do to not only take care of yourself, but your team?
I fell in, I think, to the cult of the startup in the early days. I felt like there was only one speed, and it was on all the time. And,
Right.
in those early days, your idea can be just all consuming, and you can start to sacrifice your health, your sleep, all the things that we talk to our members about, prioritizing. And so I'd say first and foremost, I read this book probably a couple years now. It's been about 4 years, actually. It's exactly when my daughter was born, called Essentialism. And it was the disciplined pursuit of less but better. And so I'd say guiding principle one is probably a focus on the basics. I'd wake up early. For me, that means waking up at 5:30 a.m. before my daughter gets up, and get to the gym. It's sleeping 8 hours a night consistently, eating all my meals consistently, meditating more regularly in my walks to the office. Again, I wouldn't say these are groundbreaking, but the consistency in it, and this, kind of common refrain or mantra I'd remind myself, which is to do you focus on yourself and taking care of yourself, and the rest will follow. I think that's been a big part. I'd say the other big one has really been finding my tribe. I have a group of people that I've relied on over the years, both informal and formal. The formal outlet has been a group called Forum, which is basically a half day monthly gathering of fellow entrepreneurs. It's led by a trained facilitator. It's been modeled after YPO. It was sponsored by one of our early investors, True Ventures. And we've been together now for over 5 years. And it's been just an incredibly powerful resource to talk through, personal, family, work challenges. And I think all of our individual life situations have changed, from acquisitions to failures, from new companies to still staying in the same company. But having that resource or that forum where there's no advice, there's really just observation, has been so helpful in helping me slow down, take the time to pause, to reflect, to build up resiliency, to be able to learn and change, and make sure that I'm coping with stress in healthy ways along the way. That's been really powerful for me, and something that, frankly, I never learned, certainly not in grad school or even in all the startup finishing schools that we were part of, from Techstars to others. And I think when I look back, is just such a critical part of success, and ultimately of us being able to continue to scale, and frankly, for me to continue to be in this game, is that, I love this mission, and got to figure out resources to be able to take care of yourself.
Yeah, it's interesting. I think that one of the reasons people don't learn those skills earlier in life, I think it has something to do with stigma. And stigma is obviously the focus of this podcast. It's a large part of the focus of my business. And, one of the things I like to ask many people on this show as we kind of come to the end of our time is, with respect to stigma, I think we can agree that it's decreasing to some extent because people are talking about mental health more. But what do we need to be doing? What can we be doing to further increase it so that it's not just, hey, COVID is a big deal and mental health is part of how you deal with social isolationism. So let's talk about it now. And then that goes away in a year. How do we amp up the conversation and reduce stigma even more than what we're doing now?
Well, conversations like this and the work, frankly, that you're doing to really get people to talk is such a big part of it. I'd say, a couple points. One, getting leaders to talk about this, and certainly, in the workplace, we feel like that's a really great place to have this conversation, as uncomfortable as it is for so many people. We're also finding that there's real receptivity, that, even in the last few years, that dynamic is changing because people are asking for support. They're being more vocal. They're willing to be talking about it publicly. And so I think there's no replacement for talking about it, and especially talking about it in the workplace, because employers play just such a outsized role in the decisions of how healthcare gets spent in this country, and can ultimately then influence, federal or state policy. I'd also say that there's probably just as importantly a new culture around what support means. So not just the stigma and being open about the challenges you face, but being open and public about the ways in which we deal with and cope with and find support. And, that's clearly so much bigger than just call it a visit to see a therapist or psychiatrist. Those are really important. And there's a lot of other things I think that are also important, from, day-to-day check-ins with a coach to meditation, to breathing exercises, gratitude journals. There's a variety of ways in which people are kind of seeking access to support or to care that are non-traditional. And so I think that is a big part of the stigma conversation, is we're being more open about the fact that this is, quote unquote, something that most everyone goes through. And especially for those that are most acute, is so hard to talk about, but people are talking about it. But then it's how do we make sure that those folks are actually getting the support they need and that they're able to take that next step? Because that's, I think, where this conversation ultimately needs to evolve. And, it needs to start with getting through the front door, and then it needs to make sure that you get through that door, and it leads to a variety of other doors that are personalized to your situation. And so I love what you're doing here. And I think that the more and diversity of guests you can have on the show, of evidence we can do to support that this is something that most everyone goes through, and that when they seek care, they actually get better, and that ultimately that getting better equates to an increase in societal ROI, if you will, from a specific, whether it's productivity increases, absenteeism, et cetera, that ultimately, I think people start to recognize that this needs to come out of the shadows and really, really matters.
Well, look, I appreciate you sharing that, and I'm really grateful that you took the time to have this conversation, tell us more about Ginger, and talk about these care delivery models, and talk about stigma and what entrepreneurs can be doing in this space. Is there anything that I forgot, that I missed, other than the origin of the name of the company?
No, I think this is a wide-ranging discussion. I think maybe just to highlight, particularly to your question around the entrepreneurs and the, or others that might be jumping into the space, love the energy. Equally importantly, we have had situations over the years where we've actually absorbed teams, had folks join forces. This is a team sport. And so I'd say, please ask for help, reach out. Everyone wants you to be successful, and I would love to be able to do my part to help if you're going through any struggle, and or if you're looking for any advice about your specific idea. But we really need a lot of great innovation, a lot of great energy to crack this at a societal level.
I think you're about to hear from a lot of pre-seed entrepreneurs. So good for you, man.
Sounds great, Stephen.
Send the good ones our way, by the way.
Deal.
Look, man, thank you for doing this. I'm really grateful to have you on. I think people will get a lot out of this conversation. And I'm just, again, thank you from the bottom of my heart for taking time to do this, man.
Pleasure's all mine.
So, Karan, thank you again, man, for coming on. And to our listeners, thank you for being here. We're really grateful to have you. Again, we'd love to, as always, we'd love to hear your feedback. Please engage with us on Twitter, on our website, on other social media platforms. If you wouldn't mind, you go into your podcast platform of choice and giving us a like or a subscribe or a nice friendly review. That helps us grow our reach. But until next time, thank you for being here, and we'll talk soon.